The programs of the government talking about controlling population, the family planning programs, all these have helped in bringing the fertility rate down. Does diet and fertility play an important role in maintaining the fertility? Yes, I think diet and lifestyle actually plays a very important role. Hi, I'm Dr. Nandita Palshetkar, Head of Department of IVF Department, Bloom IVF, Leelavati Hospital. The Lancet actually published a global research which actually said that the fertility rate in our country has dropped from 6.2, which was in 1950s, to 2.1 in 2021. In fact, the scary part is that it's going to drop 1.29 in 2050 and 1.04 in 2100. And I think that is very, very scary, because what will happen is that the population will go down. So, the question that arises in our mind is why? What has caused it? I think the programs of the government talking about controlling population, the family planning programs, all these have helped in bringing the fertility rate down. In fact, it can be attributed to various factors. Increased access to education and employment opportunities for women, urbanization leading to smaller family size, improved health care resulting in lower child mortality rates, and the availability of contraception, it leads to better family planning. Does diet and fertility play an important role in maintaining the fertility? Yes, I think diet and lifestyle actually plays a very important role. A balanced diet which is rich in nutrients, what you need is folic acid, zinc, antioxidants. It actually supports reproductive health, regular exercise, maintaining a healthy weight, avoiding smoking and excessive alcohol consumption, and managing stress provides a positive impact on fertility. In fact, whenever I see patients in my clinic, I always tell them 4 pillars are very important. First is nutrition, which should be really give you all the micronutrients, the vitamins, and the antioxidants. Second is exercise, because exercise really keeps you healthy, and it generates the cells to create good, it gets the cells working better and the metabolism much better. The third is mental health. Mental health is also very important. So de-stress, sleep well. I think these are very important factors. And of course, fourth is medicine, the availability of different technologies to help you conceive a child. So these are very, very important factors where it's important to conceive a child. What should be done to improve fertility rates? I think, there's a lot of confusion between this article and fertility. Actually, the article talks about how good our family planning process is. But if you look at fertility, on the whole, fertility is on the decline. The WHO study says there's 17.5% infertility in the country. And if you look at it, you have to remember that, as I mentioned before, you have to focus on adopting a healthy lifestyle. That includes a nutritious diet, exercise, sleep, and of course, as I said, mental health also. And also medical interventions are very important. In some cases you may need medical therapy or even surgical therapy. A lot of my patients which come, maybe 30 to 40% actually conceive with just medical therapy or surgery, but the rest do need IVF. And I think today the technology is available to our generations, and you may think it's expensive, but there are a lot of budget centers, a lot of government centers which are offering IVF at a lower cost. So I think the technology has advanced so much that it can help couples to get pregnant and to have a child. So I think you should change your lifestyle, and use medical help whenever necessary to improve our fertility rates in our country.